Good morning. Thank you all for making an effort to wake up on Saturday morning and attend the symposium. I'm sure you will learn many exciting things, or if I'm sure most of you know most of them already, so it's nice to confirm your knowledge and again confirm and reassure how good the results can be. So today we'll be talking about treating skin of color with Gentler. Skin of color is the skin which many practitioners hesitate to treat because its unique features and differences and the way it can react to treatment and inflammation. And today we will talk about how to reduce the risks and amplify your results using Gentler. So Alexandra already introduced myself. I live and work in the UK. My background in dentistry is 20 years of dentistry. However, we established aesthetic clinic together with my husband, and I have been having profound interest, special interest in aesthetics since for the last 12 years really. And I've done lots of specialist training since, including dermatology training and diploma, and I continuously learn and I teach and I still learn myself. I'm sure that all of you are, because you all turned up this morning. So skin is something I'm really passionate about, and like I already mentioned, especially skin of color, because it's always been like a area, no-go area for many practitioners. And 2 years ago, this device first made its way in the UK, and potentially first in the Europe as well, as far as I'm aware. And since, for the last 2 years, we've been successfully treating our patients, and it transformed our clinic, it transformed my practice, it transformed the lives and the faces of our patients. So it's truly a unique device because you can treat pretty much all skin concerns with Gentler, cosmetic skin concerns. Just to get to know you a little bit better, can I ask who already has this device in their practice? So you're all familiar with it, pretty much most of you are familiar with it. So I'm sure you will agree, and if you do disagree, please feel free. We'll have a questions and answers section, and you can all ask or suggest your own thoughts and opinions. What's unique about this device you already know. Just quickly go over the anatomy and physiology. So what is skin of color? So it's the skin, the way we describe the skin of certain ethnicities, individuals from certain areas. However, light-skinned people, Caucasians, can also have skin of color. So it's not the color of the skin, it's how the skin reacts and behaves when exposed to UV radiation and inflammation, i.e. our treatment. So we know there are 6 Fitzpatrick types, and so there are 6 Fitzpatrick types, and they don't just describe the skin color, eye, hair color, they also describe how skin responds to UV radiation. But we also know that's not just UV, that's also heat and inflammation. But really, there is not just 6 skin types, there are so many variations of tones and skin shades, and it's beautiful, and we need to be confident to treat all these individuals as clinicians. We need to be able to give them our best advice. So can you recognize skin of color by just looking at it? Like we already know, it's not just the look of the skin, it's also how it behaves. So after you've done your visual assessment with your patients, you want, and obviously gathered their medical history, you want to ask questions like, how does their skin react to vaccines, tattoos, piercings? So that will give you lots of information if they have scars or pigmentation, and that's how you will get an idea what type of skin they have and how you should approach treating it. Where possible, you want to ask about their ethnic background, but it's not always possible. So in literature, I've come across this test. It's digital and Palmer crease hue test. As a dentist, I also know that gums pigmentation gives it away. So there are lots of little clues you can look for when a light, fair-skinned individual sat in front of you, because you want to be careful assessing what type of skin they have. So these are little clues you can use. Why? What's so different about skin of color? So it's about the type and the amount of melanin the skin can produce. Because we'll all have the same amount of melanocytes, whether dark or light, but it's the quality and the type of that melanin the skin produces. So pheomelanin, which is predominant in fair-skinned individuals, and eumelanin, which is stable, it's predominant in dark skin type individuals. So skin tone is determined by the amount of melanin, activity of melanocytes, distribution of melanin, and the quality of melanin. So melanosomes in the darker skin are packed with that melanin, and melanosomes in the lighter skin has less amount of pigment in them. There are other unique differences which explain why skin of color behaves differently, ages differently. So stratum corneum is denser, it's more compact, there are more layers, so it's not necessarily thicker, it's denser. However, the transepidermal water loss and permeability is still higher in darker skin types. As we already know, melanocytes are more active. So the skin is more sensitive because of that transepidermal water loss, but dermis, whether it's developed because of the more vulnerable epidermis or not, but studies show that dermis is thicker, fibroblasts are larger, more active, and that would explain why skin of color is less prone to static wrinkles. Also, it's more oily, so that's why it's less prone to static wrinkles, yeah. So it's a blessing, really. Okay, happy to move on? So melanocytes, you already know that. It's working cells of epidermis. They live on the basal membrane, and every 10th cell on epidermis is melanocyte. So it's where the cells are very nicely organized before they sporadically start moving upwards as a result of skin turnover cycle. So melanocyte and keratinocyte constantly communicate with each other through those dendrites. So when skin is exposed to UV radiation, the keratinocyte nucleus perceives it via pro-opium melanocortin complex, and melanocyte-stimulating hormone transfers the signal to melanocyte membrane, which is perceived by melanocortin receptor 1, and melanin production starts, and then it gets back to melanosomes and transferred back to keratinocyte, where they form a veil over the nucleus of that keratinocyte, which, to protect it from further exposure, this would explain the tanning as a protection reaction of our skin. So that's how normal pigment is formed, but also when it happens at an uncontrolled rate as a result of inflammation, it can turn into hyperproduction of melanin. You also will know that melanin production process is controlled by tyrosinase. It's the enzyme which controls the whole process, the initial reaction of that process, so tyrosine conversion to L-DOPA. But by controlling tyrosinase, by protecting skin from free radicals, because it's more sensitive, remember, and by protecting it from UV exposure, we can slow down hyperpigmentation and also aging. Why not? So, free radicals, do you remember? They are the atoms which have lost electrons, so they go crazy, they go stealing atoms from from all other atoms and molecules. But then there are antioxidants, which are stable molecules and which lend that lost electron, and they stop that reaction of oxidative stress. And this is what you want to give your patients before your treatment. So all these ingredients in the topical skincare, look out for all those ingredients to control, to control and slow down the oxidative stress in the skin. antioxidants is a really must in any skincare, especially before you're about to go in and induce that trauma with your treatment. Tyrosinase inhibitors, this is just a quick list, I'm sure you know it all, just look for those ingredients in your topical skincare. So we want to control the melanogenesis, we want to slow down the melanin production by inhibiting tyrosinase. So free radicals, we're controlling by antioxidants, hyperproduction of melanin we control by tyrosinase inhibitors. And of course UV is your sunblock, that's easy. So we already established that skin pigmentation is normal, it's a defensive skin protection against radiation. However, hyperpigmentation is abnormal, not even uneven skin reaction to inflammation or UV reaction, UV exposure. So hyperpigmentation is can be subdivided to photopigmentation, which is UV-induced, post-inflammatory, which you will know from the history, what caused it, and hormonal melasma. So that's by gathering patients' history, medical history, treatment history, that will give you an idea what kind of hyperpigmentation you're dealing with. And then there are, of course, other concerns for skin of color. Dyschromias, there's not just hyper, there's also hypopigmentation, which is less common, they're just rare, but it tends to be transient, it tends to sort itself out, but all your precautions would be the same, protect the skin, to protect the skin. Then the skin of color is also more prone to hypertrophic and keloid scarring, and again, gathering history would help you to determine that. It's also more prone to develop ashy, dry appearance because it's more oily. It can develop acne, cosmetic acne, milia, and so on. So you would still treat the first two with your devices, and you can still treat them. With the last one, I would be careful. I will rule out the dermatosis, papillose dermatosis, but if it's milia, then you will see later you can treat them. And of course, you will come across the pseudofolliculitis barbae. I won't stop here much. It's patient education, it's reducing the inflammation, and you can still treat that too. So, pre-treatment, just to recap. Pre-treatment, we need to improve the barrier function by giving them antioxidants to protect the skin, to strengthen the skin. We need to inhibit melanogenesis by controlling tyrosinase. And we need to make sure they use the sunblock. I would say 2 to 3 weeks before treatment, we need to condition that skin into the procedure before we just go and cause that trauma. And we've already touched up on this. These are the ingredients, the antioxidants, and your ingredients. Just to quickly bring your attention to, it has to be medical grade skincare, cosmeceuticals, because of the molecular weight. You all will know that over-the-counter products, topical products, have higher molecular weight, so they do not penetrate our skin. It has to be medical grade skincare. It's all about the molecular size and weight, 500 Dalton rule. Anything higher does not penetrate, it has to be lower. A delivery system is important. Many cosmeceuticals have their active delivery system which drag ingredients through the skin, and concentration of the active ingredients is also important. So when you choose your pre-treatment topicals, pay attention to that. So you can use combination treatments with Gentlo. You can do chemical peels to prepare their epidermis, but your my main goal is dermis when I treat skin, so this is where your energy devices come in. Factors you want to consider is how much trauma you're about to cause, what is going to be the downtime, what is the patient's budget, and what is this, obviously, skin goals, what is their initial concern they've come to you with. So with the Gentlo, you can introduce mesotherapy products into the skin. So as you know, mesotherapy can be injected, rolled, or it can be delivered with plasma. Plasma is amazing technology. I'm sure my colleagues will speak a little bit more in depth about this. Plasma is technology which allows penetration of topical products through the epidermis because it temporarily breaks the adhesion between the epidermis cells and allows the products to pass. Oh, sorry, I'm going back. Pass through. So there's a little video. I'll try to play it to you. So just to simplify, this is how it works. Yeah, and the products get delivered through the epidermis. So this is how you can target your epidermis to prepare them for more aggressive, more effective treatment, shall I say. So this is just to show that before I had plasma, my patients were covered in blood when I was doing mesotherapy, and after I had plasma, my patients were popping in their lunchtime and having that cocktail of active ingredients, not injected, delivered into their skin. So it's no needle mesotherapy. I think plasma is a wonderful tool to have in your practice because nobody wants downtime these days. Nobody wants bruising. Nobody wants to be covered in blood. You don't want that splashback of blood. Plasma is nice, clean, easy, painless procedure. The results are amazing. No trauma, consider there's no trauma being done, and the skin looks so much better, so much fresher, it's glowing. Hyaluronic had, on the Hyaluronic website, many people of you are Hyaluronic customers already, there was a video, one of the very first videos, where one side of the face was treated with plasma and the other one wasn't, and then they applied oil and put a tissue on it. And the side which was treated with plasma was the tissue was completely dry because oil would penetrate the skin pretty much instantly. And the other side tissue would be saturated with oil because that oil sat on the surface of the skin. So that was really mind-blowing thing to see. So you can treat pretty much any concern. Dark circles under eyes, which is such a big concern for skin of color, for darker skin. You can treat with mesotherapy, with plasma. No bruising, no needles, painless procedure. Apply your meso product, whichever product you prefer. Brilliant. Uneven skin tone, again, pigmentation, skin of hyperpigmentation and skin of color. How even is this? Have a look. It's 20-minute procedure, no pain. Patients pop in a few weeks apart and just get that cocktail delivered in their skin to control that melanogenesis slowly. That's another important thing to tell your patients, which I'm sure you do. It's a slow process. We do not bleach the skin. We control that during that new skin cycle, during that new skin cell turnover, we control that melanin production. So they have to give it time to work. Okay, now this is my favorite bit. This is the bit I'm raving about, and this is the bit which really gives us good results. So we all know about benefits of microneedling. It's collagen boosting procedure. It's been used in medicine since hundreds and hundreds of years. Some people say it originated in ancient China from acupuncture. Radiofrequency been used over 100 years, but there's a problem, because you used to work on the surface of the skin. We cannot control, because it's not heat originally, it's electromagnetic current. But as it travels through the layers of the skin, with that resistance it means, it heats up. So we don't know when that heat, that break point of that heat happens. And if it happens on the level of basal membrane, it can upset our melanocytes. It can cause hyperpigmentation. This is where for skin of color, my choice would be radiofrequency microneedling, where the needles are charged with radiofrequency. They go through the skin, they're as thin as your hair, they hardly cause any trauma. You've seen what your patients look like, they're just a little bit red. They go through the skin, they shoot, they come out. And this is the beauty of this technology, because it's so efficient, yet so gentle. Because in skincare, with devices, you know, anything what works is very traumatic, it gives patients downtime, so it's effective, but it's aggressive. With this one, it's aggressive, as in not, it's effective, but it's not aggressive, it's gentle. So this is, my patients literally have a couple of hours of redness. I ask them all when they come back, a couple of hours of redness, wonderful. It's like nothing ever been done. So injury and repair principle is in the core of both technologies, both radiofrequency and microneedling. We cause controlled injury to get our body to repair itself, because skin is the most self-sufficient organ we have. It's never in the priority of our body to repair the skin, but everything changes when there's an injury. Then our brain goes, aha, I need to go and repair it. So this is why we cause this controlled injury, to get that repair response. What's beautiful about GenGlow, because I looked into most of radiofrequency microneedling devices out there, not every device gives you a choice of insulated and non-insulated needles. So I will use non-insulated needles. I guess you all understand what insulated means, yes? So non-insulated is when radio frequency is delivered throughout the whole needle. So we target all layers of the skin, we cause more controlled trauma, we get more response, we get more inflammation as well. Insulated needles, it's only the tip of the needle which delivers radio frequency. Hence, by controlling the depth, when we preset the depth, we know that we have bypassed that basal membrane, we have bypassed the melanocytes, and we are safe to shoot that radio frequency energy. So this will be my choice for skin of color. A non-insulated I would use for lighter skin, where we are safer to treat it when we want to resurface the skin, we want to cause more trauma. So this is where we can choose non-insulated needles. With so this is gives you more. This graph gives you more information. So we have to be in the dermis with our needle tip. We have to be in the dermis. So we preset in all areas of the face where the thickness of epidermis is different. We will preset the depth accordingly. And with GenGlow, the beauty is you don't have to think about it. You can save your settings, and you can just change, click eyes, cheeks, etc. It will be all saved for you on the device. It's a very intelligent device. And also the size of the needle tip, you can choose. Not every manufacturer gives you the choice of the different size. So everybody is different. My personal preference would be 49 pin, because as you can see, needles are closer, so I can, with one shot, I can capture wider area and cause more injury, controlled injury. But again, I work with smaller needles as well in certain areas, so it's just a personal preference. I'm sure many of you love the single needle RF. Needles are always insulated. You would use them for acne, milia, sebaceous cysts. I also use them for a hyperhidrosis, especially in the upper lip, where you don't want to give Botox. As a dentist, I would never give Botox for hyperhidrosis in upper lip, because that can cause all sorts of issues. The muscles here do so much that you don't want to get them with your Botox. But the radiofrequency microneedling will reduce the activity of sweat glands, sebaceous glands, etc. So that's great additional technology to have on your device. So you've all done this. By the looks of it, you all use this. You see how comfortable is this procedure to the patient. She's smiling, she's chatting, a little bit of topical. Some of my patients don't even have topical anesthetic, because we want to get that erythema, we want to get that reaction, so it's easily tolerable, even without topical anesthetic. Of course, you will gauge what your patient's tolerance is like before you do that. And as you can see, patient satisfaction rate is great, and you can target most of cosmetic skin concerns with this. So these are a few case studies, results. So you can see the settings we used here. Most of these patients have higher Fitzpatrick type, and we still managed to get good results and avoided hyperpigmentation and dyschromias. For scarring, beautiful, isn't it? Beautiful result. Aging, fine lines and wrinkles. Stretch marks, really good. There's not much you can do with stretch marks. Really good, because stretch marks is really scars, aren't they? And I shall use this, shall I? You told me that this is a great thing to use. I'm playing with it now. So yeah, hyperpigmentation. See, the patient came with this concern, and look. Yeah, so cleared up her skin beautifully. So that's the same patient. You can see it's a better angle. So this is one of the most amazing responses to treatment. This was life-changing, really, truly life-changing transformation. In most of my talks, I like playing the game when I ask the audience, guess what she had? But you already know, because the topic of this talk is gentler. Of course, she had upper face toxin, I won't deny that. But the skin, look at the transformation in her skin. And she had a little bit of a lip filler, but there are no mid-face fillers, yeah? All that skin is down to gentler. So she didn't have anything else on her skin apart from radiofrequency microneedling and mesotherapy. So with Gentlo, I probably skip that bit. You can also, after the procedure, most of you would apply mesotherapy product, wouldn't you, after radiofrequency microneedling. So I wouldn't just do it with just mesotherapy. I would do the whole Gentlo treatment, and I would also apply mesotherapy. So that's what this patient had. So she had radiofrequency microneedling and meso products on top of that. So in summary, when treating skin of color, we prepare the skin. We will avoid aggressive treatment plans, so we will tune down our energy. We would use insulated needles, and we will space out those treatments so we can watch how they respond to your treatment. So if for lighter skin individual, I would say, yeah, come back in 3-4 weeks. Then for skin of color, darker skin, I would say, shouldn't say darker because it's not just the color, is it? For skin of color, I would say come back in 6 weeks. So it's very important to space those treatments and let that skin recover fully. And aftercare, your aftercare would be similar to your pre-treatment. It would be antioxidants, tyrosinase inhibitors, and UV blocks. And references are available upon request. And that's all.